Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I just got back yesterday from teaching at Harvard, and it's always a pleasure to see the incredible residents and faculty there. And every time I'm there, the legendary Don Nelson always presents his beautiful cases, case after case of just perfect orthodontics, and he is the perfect combination of master clinician and academic. So I love being in the classroom when he is lecturing. So this clinical pearl is attributed to him and dedicated to him. So we've talked before, for maxillary hypoplastic patients, you often will have labially displaced canines. And the follicle of those canines can resorb the apical third of the lateral incisor. Remember that apical 1/3 is the danger zone. So we talked about doing overexpansion, even accepting a temporary buccal crossbite to make sure those canines can deflect into that funnel between the lateral and the first premolar. Well, here's the pearl here, and this one is dedicated to Dr. Nelson. A lot of times during panoramic radiographs, when you're trying to evaluate to see if the canine has autonomously corrected after you've expanded, the jack screw on the panoramic radiograph, the radio opacity from that jack screw, from the center part of the expander, covers the apical third of the lateral incisor. It's directly in the path, and you are not able to determine if the lateral incisor is being resorbed. So here's what you need to do. You need to remove the expander or cut out the jack screw to really get a good look, or simply take a CT scan. But that is going to be needed to get an accurate assessment, and sometimes you simply may need a second expander for greater expansion, or you need to surgically expose those labially displaced canines and open up that follicle and move that canine crown off the roots of the lateral incisor. So the pearl here is, one, remember what we talked about before, overexpand for LDCs. We're worried about the follicle of the canine resorbing the apical 1/3 of the lateral incisor because you often have LDCs associated with arch length constriction. But number two, when you take a progress panoramic radiograph, the jack screw is often at the apical third of the lateral, and you are unable to determine if that follicle is resorbing the root. So you need to section out the jack screw or remove the expander to get a good look. Put the expander back in, or make a second expander if you need more expansion. Hope you enjoyed this pearl. Shout out to the legendary Dr. Nelson. You are the best. Thank you guys so much for subscribing to this channel. Thank you for supporting the JCO.